Good evening, everybody. Thank you very much for joining us at the SAAHE Eastern Cape Chapter's third webinar, the State of Interprofessional Education at the 4 Eastern Cape universities. The focus will be on the health sciences faculties, and our presenters will share insights from their respective institutions. So without further delay, this is just a slide to show you guys how we have set out the program and which colleagues or the university will start first. So we've got our colleagues from Fort Hare University that will be presenting their insights to us, and the title of their presentation is From Me to We, Transforming Healthcare Through IPE. So the first presenter, because there will be two presenters from Fort Hare, the first one, allow me to introduce to you Ms. Refiloe Masinge. She is a speech therapist by profession, and she is committed to sharing knowledge. So there is no better platform than tonight's webinar for her to share her university's insights with us. The second or the other presenter that we have is Mrs. Helen Bunt, and she is a registered professional nurse, and her areas of interest are palliative care, HIV/AIDS, and mHealth. So without further delay, I'm going to hand over to our speakers, and we look forward to hearing what you've got to share with us. Thank you.
Good evening, colleagues. Mrs. Bunt, do you mind sharing the screen for us? Thank you so much. My name is Refiloe Masinge, and I'm a clinical preceptor at the University of Fort Hare. So I'm going to start our presentation today. So it's titled From Me to We, Transforming Healthcare Through Interprofessional Education, IPE. So now, the World Health Organization defines interprofessional education as when a student from two or more professions learn about, from, and with each other to enable effective collaboration and improve healthcare outcomes. Because IPE is still in its infant stage at the University of Fort Hare, how we explain interprofessional collaboration is that it's a collaborative learning approach where students from the speech language pathology department and the nursing departments learn with, from, and about each other. So this joint education prepares students who work to work effectively as a team. It fosters communication and understanding, mutual respect across discipline, and it enhances patient care and improve healthcare outcomes in our communities. So now the why part of the IPE. So to define the why part of our IPE, I'm going to draw from the study that was done by one of our colleagues, Ms. C. Christians. So her study was titled The Multi-Professional Collaboration in Rural Setting, Healthcare Professional Perception of Speech Language Therapy. So the rationale was that in healthcare, the multi-professional collaboration is often undervalued despite its proven benefits for patient outcomes. So now understanding how healthcare professionals collaborate with speech language therapists in rural South Africa offers a valuable insight for enhancing interprofessional education for healthcare students. Now, in her study, she used a qualitative approach that involved a semi-structured interview with three healthcare professionals in the rural Eastern Cape province. So the interviews were transcribed and analyzed using the interpretative phenomenological analysis to identify the key themes. Now, her finding suggested that the themes that emerged highlighted the significance of professional respect, trust, shared activities in fostering collaboration with the speech language therapists. So that the unique dynamics of rural setting, including close professional ties and community relationships, plays a crucial role in shaping this interaction. So now, in conclusion, his study um, highlighted the importance of integrating this rural collaboration insight into our IPE program. So, by focusing on the role, clarity, equitable power dynamic, and the interplay between professionals and professional relationship, IPE can better prepare healthcare students for effective teamwork in rural settings. So, strengthening governance, formalizing collaboration, enhancing education are essential to equip the students with skills that are needed for a successful interprofessional practice in our rural care settings. So now, furthermore, the research suggested that we should explore how IPE influences the students' readiness and patient outcome in the rural context. So now, way. So I'm going to hand over to Mrs. Bunt to give an overview of the departments participating.
Sorry, speaking to myself. Good evening, colleagues. So further rationale. So why do we do this? We're really interested in IPE because it's what brings teamwork, and that teamwork is essential for patient care. We also bring a different perspective. Each profession has its own emphasis and its own view of the patient. And so as we come together, we can form a rainbow. We each have our different facet, and it brings about this holistic viewpoint. And we see that as hugely, hugely valuable. So this interdisciplinary, we need to work as a team, because in real life, we will be more than just one person caring for the patient. And so we see that as important, starting from the education. So we started our little project in Fort Hare. Speech and language department has about 120 students, and nursing 250 odd. Within the faculty, we also have human movement and public health, and they are a further about 350 students. But we started small. We started where we are, speech and language and nursing. And this is our classroom. In fact, we've been kicked out of our classrooms and having to use another venue, and everything is a bit upside down. But despite all of that, we brought our students together, and we had a really interesting interaction. Ms. Masinge, I don't know if you want to add something to that about our collaboration.
Thank you so much, Mrs. Bunt. I think I would add on the examples of the IPE activities that we had. So, like I've explained in the beginning, our interprofessional education is still in its infant stage. So we had our first interprofessional education on the 26th of August this year. So it was between the first year nursing students and the third year speech language pathology students. So it was a health awareness education that was done by the third year speech language pathology students. It was about dysphagia. So upon having that session with the first year nursing students, it opened us up also as lecturers, as clinical supervisors, to want to have more of this collaboration. I think in the previous SAAHE conference, we had listened to IPE and how different universities that are not in the rural areas of the Eastern Cape do the interprofessional collaboration. But with us, we're still in our infant stage, and we would love to thrive and also embed this IPE into our learning outcomes, or maybe also have a special module. But for now, what we have done in terms of IPE is health awareness and education. So we would love to expand it to more simulation, to more clinical cases. So I think we are going to have our next interprofessional education soon. I think it might happen this month or next month, I think, depending on the schedules of my colleagues.
Thank you. And then we've also had an international online exchange called Family Crisis, and that has been really interesting. We're more than 10 universities internationally that participate in that every year. It's over Zoom, and each student talks about family crisis, and it's mostly nursing, but it is open to any healthcare departments or faculties, and that has worked very well over the past about 6 years we've been doing that. The objectives for IPE was really to foster collaboration across disciplines, enhancing communication and problem solving, preparing the students for the real world. And I think for me, the most important thing is that curiosity. Rather than judging, oh, why does this professional do this? Or, you know, why doesn't this doctor prescribe or that nurse do this? The curiosity, I wonder why, what is it that we're missing between us in this situation? So that curiosity of trying to understand, to improve understanding in professional roles. Many challenges, of course, just the time schedules and interdepartmental coordination, and that idea of, oh, what has speech got to teach my nursing students, for example. I'm sure we've all had that kind of experience before. But there are many opportunities too. Expanding our programs both within and further afield than our faculties, using new technology and strengthening partnerships. So within the hospitals and to the education department, but then also internationally. And so in summary, we see many opportunities to explore, and we need to keep looking for those. To me, I think this is something really important, because otherwise I would certainly miss it. Know the benefits and downfalls, start small. And I think that our little collaboration, our one little class, is something that we will talk about to our colleagues, and that will spur them on to something further in the future. Anyway, that's certainly what we hope. So thank you very much. I think our time is up, but Ms. Masinge, I don't know if you've got anything else to add.
I have nothing to add, but thank you so much, Mrs. Bunt. Thank you, colleagues, for giving us this opportunity.
Thank you, colleagues.
Thank you so much, Ms. Masinge and Mrs. Bunt, for sharing all of your insights there. We truly do appreciate it. The questions and answers will be at the end when all of the presentations have been concluded. So please, colleagues, get all your questions ready, and then we can have some discussion at the end of the presentations. Without further delay, we are going to go ahead with our second presentation. And sorry, my apologies. And here we have the colleagues, or the colleague from Rhodes University, that will be presenting the interprofessional collaboration through service learning community engagement. And the presenter is Mrs. Monique Purcell. She is a pharmacist with a passion for developing the professional identities of students through their work-based learning, especially with service learning. Within service learning, my apologies. So I would like to hand over to you, Monique. Thank you very much.
There we go. All right. Evening, everyone. So my topic this evening is the interprofessional collaboration through service learning within community engagement at Rhodes University, and specifically within the Faculty of Pharmacy. So the Faculty of Pharmacy at Rhodes started a community experiential program approximately 26 years ago, and that was by Prof. Sue Burton. And this program has since developed into more of a service learning course. Rhodes regards community engagement as one of its main pillars, and so developing a partnership with the Eastern Cape Department of Health came through this process. Through the initial experiential program, patients were visited at their homes, and then they had referrals to CHCs. But after COVID, you can imagine things changed for the worse, but they also changed for the better. What happened was we were able to obtain a mobile trailer through funding, through the clinical training grant, through the Department of Higher Education and Training. And we decided to name the trailer Sakhimpilo, which means to build health in isiXhosa. And we started taking our pharmacy students out as of August last year. So this allowed the service learning program to begin to reach more underserved areas located further away from healthcare facilities. Together with the Eastern Cape Department of Health, we also developed a referral system focusing on the nearest PHCs. And we also began to offer more health services with the assistance of the clinic staff at those PHCs. We take our BPharm third and fourth year students and we get them to complete SOAPs with the patient. They also perform various screening tests and provide specific patient healthcare education. The clinic outreach team, usually consisting of nurses and community healthcare workers, they offer HIV, TB, and HPV screening at the site, as well as pediatric health services. So we are quite fortunate at Rhodes to have the Sakhimpilo visits facilitated by staff with varying expertise. We usually have at least one pharmacist and either have a nurse or a medical doctor, and sometimes both, facilitating the pharmacy students. We also have MPharm students who assist us as well, and together we function as a comprehensive healthcare team, facilitating the pharmacy students' provision of quality healthcare services to the community. Because of the Service Learning Foundation of the mutually beneficial partnership with the Eastern Cape Department of Health, we as the healthcare practitioners from Rhodes University work collaboratively with the team here in Makanda at the Makana Sub-District Office. This begins from the planning stages of the Sakhimpilo visits, and it continues with each visit, where we work closely with the clinic staff, offering additional healthcare services at each Sakhimpilo visit. The staff included are nurses and the healthcare workers. And excuse me, from the image on the slide, you can also see their gazebos that are set up next to ours. And together we provide an excellent opportunity for the students to be able to witness this interprofessional healthcare team effort. The work needed to plan and facilitate these visits has fostered an excellent partnership between ourselves and the sub-district, and we are indeed very privileged to work with such passionate and hardworking healthcare workers. Looking at the overall experience for our pharmacy students, they become very aware of the healthcare needs within their community, all the while experiencing healthcare services being provided within a comprehensive healthcare team. They witness patients experiencing a multifaceted health assessment and the collaborative partnership with the Eastern Cape Department of Health. Being out in the community and offering health services also fosters the students' civic responsibility, especially within a collective service learning-based practice within the Makana community. So finally, just keeping in mind that Rhodes only has 3 health science-related degrees. We have pharmacy, psychology, and human kinetics and ergonomics. We have a relatively small health science complement. However, we are starting to identify areas, especially within the Sakhimpilo visits, which we only started last year for the pharmacy students, where we would be able to expand our interprofessional education strategies to include our colleagues and students in the psychology and HKE departments. And that's all from me. Thank you.
Thank you so much, Monique. Much appreciated. And I see that we still had 2 minutes to go. So you've been going along very well. Thank you very much. Our next speaker, and once again, like I said, questions and answers at the end. Our next speaker is from the Nelson Mandela University. And the presentation title is State of IPE at Nelson Mandela University, Faculty of Health Sciences, and the presenter is Dr. Aayesha Kholvadia. She's a biokineticist and has a strong commitment to interprofessional engagement and education. And she played a huge role in advancing collaborative learning among the health sciences students. So without further delay, over to you, Dr. Kholvadia. Thank you very much.
Okay, so good evening, colleagues. As introduced, my name is Dr. Aayesha Kholvadia. I'm from Nelson Mandela University, and today I'm going to just give you a quick synopsis on the status of IPE-CP within the Faculty of Health Sciences at Mandela University. To begin this presentation, I always like to keep in the back of our mind why IPE-CP. And by IPE-CP, we're looking at interprofessional education and collaborative practice. But why is this such a buzzword within the domain of health, right? And we see that as health progresses, we want our learners and our students to work collaboratively to put the patient at the patient or the client at the center of their healthcare, which enables the patient to get a more holistic approach to their healthcare needs. So at Nelson Mandela University, we have been doing various IPE-CP activities over the last few years, and these activities take a number of different forms. Okay, so they can be in the form of facilitated IPE sessions, and these sessions are facilitated very intentionally and with a purpose, and they can be between two specific or more than two specific identified departments working on a particular case. So, for example, we have had previous workshops where we've looked at improving the diabetic status and overall health and functioning in a diabetic population. And then we would have students from our Department of Biokinetics, Department of Human Nutrition and Dietetics, Psychology, Nursing, Medical School, etc., as well as pharmacy, because all of these practitioners would come together and play their own individual part in the management of diabetes in this particular patient, but also working together, they would be able to facilitate a more coherent management plan. We also then facilitate interdisciplinary workshops, which take place again in terms of key health issues and healthcare matters that take place within the various domains. So, for example, during the COVID-19 pandemic, we had a workshop on ethics around vaccinations and how the different disciplines would approach the prescription of these interventions. Then in academia and in health and engagement, we know that we need to look at both the learning and teaching as well as the research, as well as the engagement, right? So there's also collaborative research projects, and these collaborative research projects could range between two departments and sometimes across departments and across faculties, depending on the nature of the research project. Then we also have community engagement initiatives with a focus on health. So very similar to Rhodes University, we have a mobile truck, which is called the Zanampilo truck. And this goes to our very difficult to reach communities where we have students from various disciplines that would be placed on this truck and then go to these rather remote and rural communities and then offer the services in a holistic and collaborative manner. So in looking at that, we try to identify what are the strengths of IPE CP at Mandela University. Okay. And core to our Vision 2030, we have our purpose to be in service to community. And therefore, one of our biggest strengths that we have at Mandela Uni would be a strong commitment to community engagement, that our community engagement is always community-led and community-focused. We also have been engaging with different institutions to try and identify which approach is a better approach to incorporate IPE CP within both the engagement and education paradigms of higher education. And there has been both a support from the bottom-up movement as well as the top-down movement. So it has been very important to receive support from faculty. And then also the integration across disciplines and interdisciplinary. We've also been doing a lot of work in terms of both inter, multi, and transdisciplinary research, exposing our students to not only healthcare engagement within the Faculty of Health Sciences, which has 11 different disciplines, but also outside of the faculty, where students get an opportunity to engage with other faculties. So, for example, we did a collaborative project where our biokinetic students, together with the students in architecture, worked on a collaborative project in building a recreational facility for the autism wing at one of the autism facilities in Port Elizabeth. During these processes, we have also encountered a number of challenges, and these challenges always rally around the following three things. So the first one is the lack of formal curriculum integration. In that, we find that most of our IPE CP activities are targeted more towards our senior students, so our third, fourth, and more senior students within the faculty. However, when the students are doing their engagement, they would like the feedback that we've received is they would like to be introduced to the core principles and competencies of IPE CP from a first year level. So part of our way forward is to find ways in which we can adequately integrate and scaffold formal IPE within health sciences curriculum from the beginning of training. Then also, as with all institutions, there would be limited inter-institutional collaborations because of time, funding resources, spaces within the curriculum, etc. But we do need to find ways in which we can mitigate these and be able to collaborate better interinstitutionally. And then resource limitations, because one of the key factors that we found was each discipline would come into the engagement with their own discipline language, with their own discipline-specific ways and terminology. So resources in being able to have a collaborative and common language, because one of the key aspects on which IPE CP is built is communication, and adequate communication at that. So going forward, we would like to build on this in terms of our successes and opportunities that we have that would lay ahead for us. And some of these successes look like an expansion in terms of our IPE CP sessions, having more of these sessions and also integrating them from a first year period, and then making it available throughout, and then scaffolding that into postgraduate studies. Growing research is also very important. The opportunities that we have is integrating it formally within the curriculum, and then the support in terms of institution and faculty really do play a very important and positive role. So where to from here for Mandela Uni? We aim to have more of these sessions to engage more with our neighbors within the province, nationally, as well as within the continent of Africa and internationally, to be able to work better within this domain of IPE CP. Curriculum resources and collaboration. And what that we do intend beginning small from like webinars like what we're having today to then engaging more formal structures such as short learning programs and curriculum integration. Thank you very much.
Thank you very much, Dr. Kholvadia. Much appreciated. If we can move along now to our final presenter, because we are running over a little bit over time there. It is our colleague from Walter Sisulu University with the presentation title Interprofessional Education at Walter Sisulu University. And the presenter is Professor Lucky Norah Katende-Kyenda. She is a pharmacist by profession, and her research interests are quality of life, treatment adherence, gender-based violence, and healthcare role. Without further delay, I'm handing over to Professor Norah so that she can start the presentation. Thank you.
Okay, good evening, colleagues. Thank you very much for everything and for introducing me in this IPE, because this is my first time. I'm from Walter Sisulu University. So I'm going to look at overview of IPE activities at Walter Sisulu University. And I just start off by defining what IPE is, which is a method of educating professionals together to obtain a common goal. And we all know that our common goal is to educate, to offer our education to the needy who need it. And it occurs when two or more professionals learn from and with each other to enable effective collaboration, and this improves on the learning outcomes, because different disciplines or professions, they come together and then they form IPE, and then it will be effective for the students that we are teaching. So in the Faculty of Medicine and Health Sciences at Walter Sisulu University, where I'm from, the Faculty of Medicine and Health Sciences. Here, the type of curriculum we employ is called problem-based learning. This is a new curriculum which we adopted about 10 or so years ago, whereby you see that the student has to seek solution that has been given a problem. And this, we are doing it integrating different disciplines. Yeah, so in my case, for example, I teach MBCHB level 3, that's the medical students, and we teach them in a small group, which we call, and then we use tutorials, and this is considered as the most relevant learning exercise as per research which has been done worldwide. So the philosophy we apply here is how we think students learn best and what good or what is the effectiveness in their teaching. Okay, because normally here, it is this problem-based learning is student-centered as compared to the old curriculum, whereby you just stand in front of the students and then you just give them whatever you want to give them, and then they go and memorize what you have taught. But in this case, we give them a problem and then they go and sort it out themselves. But of course, different disciplines together. So the following principle applied are: learning is motivated by the learner's need to solve a problem, as I've already alluded. And the learners, they own their learning process. They are not going to depend on the tutor or lecturer or facilitator, as we use these terms. And then they engage in seeking the solution by working as a team to contribute with the knowledge and the strategies. So this is how the integration occurs. The course is a combination of interrelated aspects. Yeah, so in third year medical school, we integrate the following fundamental disciplines or modules: anatomical pathology, chemical pathology, medical microbiology, and pharmacology. So in my case, I teach pharmacology. So the other important modules which we include in the curriculum, it is community medicine, forensic medicine, medical ethics, and research to ensure that the students' professionals progress. So the integrated of these disciplines is a requirement to enable our students to gain a realistic vision applicable to their future clinical practice, because when they're going to view a patient, they will view that patient holistically. They are not going to cut off one arm and then treat it and then leave the leg alone. So they just look at the patient as one whole. And that's why we are using this curriculum of problem-based learning and integration. So the integration of these disciplines is a requirement and enables students to gain a realistic vision applicable to the future of clinical practice. So the lecturers, as I've alluded, are from different disciplines, for example, anatomical pathology, chemical pathology, pharmacology, microbiology. So we all sit together and then we design a case. And in that case, it will cover all the 4 disciplines plus the others that I mentioned, like community medicine, forensic medicine. So here we ensure that the integrated learning and interprofessional education and collaboration is achieved. So the perspectives of the 4 EC universities, as we have been introduced, at the moment, there is no IPA department per se at the Faculty of Medicine and Health Sciences. But now, as you are going to assist me to see that maybe I could motivate and we have a separate IPE department in the Faculty of Medicine and Health Sciences. So the different disciplines, as I've told you, that are integrated. And the students do these projects as well in one module which we call COBIS, that is a community outcome-based education service, whereby they go to the clinics, and in the clinics they are still going to apply this integrative approach as they see their trend in, for example, how to do clinical skills that they will use in their future practice, and also to carry out research projects. So therefore, any form of collaboration among the ECIPE is mostly welcome, and I would like to thank Professor Tuta for introducing me to this IPE collaboration. Thank you. Thanks, the person who put my slides up, and also, as I said, I thank Professor Ilse, who has introduced me to this, and we are going to work together, and then we make IPE stronger in the Faculty of Medicine and Health Sciences at Sisulu University. Thank you.
Thank you so much, Professor Katende-Kyenda. Much appreciated. So without further delay, I would like to open up the question and answer section to our discussion tonight. Any questions? I don't think I've seen anything in the chat, but if you can allow me maybe just to ask the colleagues from Fort Hare. So I'd just like to confirm you are still in the process of rolling out these simulation and clinical cases that the students will present. Am I correct?
Hi, colleagues. Yes, we are still in the process of establishing the cases and the CMU cases. So we just also recently started, just to answer the question, but I think we're hoping to have more success as I was listening to the other colleagues from different universities in Eastern Cape.
Thank you very much, Ms. Masinge, for that. Much appreciated for that response there. So like you've said, you guys are still new to it, but I think just the mere fact that we are testing the waters, for want of a better description of it, is already us moving along and getting there. The integrated sessions and lectures for your different departments, is that something that you are looking at as well? Is that also something that you're keeping in mind, Ms. Masinge or Mrs. Bunt?
Yes, thank you. Perhaps I can answer that one. Certainly we are. We tried very hard to get some collaboration together just to do the research modules. But in terms of time and partly curriculum as well, but the time scheduling was very difficult to do that. So we've discussed it, but we haven't got further than that. So far, we've hit some resistance, and that's as far as we have gone so far.
Thank you very much, Mrs. Bunt. Colleagues, any other questions that you would like to ask our colleagues from Fort Hare? Okay, then the presentation that, oh, sorry, I see there's a hand. Carmen Whittle, please do go ahead. Thank you.
Okay, colleagues, sorry, my name is Annalene Kietia from Nelson Mandela University, and responsible for the learning and teaching in the Faculty of Health Sciences. Sorry, Carmen just forwarded me the link again because I lost it, and I think when I then raised my hand, it came up as Carmen. So my apologies for that. Mrs. Bunt, I was wondering when you were talking about the resistance, what kind of resistance are you talking about? And is it within the institution? Is it from the faculty in general, or where does that resistance lie?
Thank you for the question. I think for many of us, it's something new, and you know how it is with change management. There's first resistance. No, you know, I'm in my quiet little corner doing my thing, and now there's this change, and I think for a number of people, that's where it is. Within the different departments, we come and say, you know, how about doing this module together, because there's a lot of overlap and we could share, you know, we could collaborate together across professions. And I think that's, we can't always see how to get around the obstacles. I think that was part of it. And I think Ms. Masinge has also got some other contribution there. I'll give her a chance.
Hi, colleagues. Just to also add some information. So I just want to speak a little bit about speech therapy. So oftentimes when you walk into a room and you ask a group of people, what is a speech therapist? What does a speech therapist do? That answer always, you'll find out that none, or some people say, oh no, they teach people how to speak, or they teach people this and then sound. So now, having to put together professionals, it's quite difficult because now it starts from, let me define my role. Who am I? What is a speech therapist? What is my role? How do we come together? Where do we overlap? How do we, I think, one of the key speakers here spoke about holistic care of patients. How do we come together and also like treat and manage patients? So that question is often like not answered properly. So now, having to put nursing and speech therapy together, we had to establish what do we do, where do we meet, who are the people we want to collaborate for. So that gave us a bit of answer to say, initially, yes, there is a lot of resistance. What am I doing with a speech therapist? What is nursing doing with the speech therapist? But we meet at hospitals, we meet at different clinics. So now the resistance is us as speech therapists having to also advocate for our profession. So that's where we oftentimes get the resistance. I hope I answered the question.
Prof. Kit, your
No,
question been answered?
I'm fine with that. I'm fine, thank you.
Awesome. Thank you very much, Mrs. Bunt and Ms. Masinge. In the chat, we have a comment. Douglas Maleka, is this a comment that you have made? Key to IPE is what Prof. Katende-Kyenda, 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 Prof a credit-bearing module assists in getting the students engaged and involved. And then I think I need to just check with Douglas to see if that was a statement, a comment, or was it a question, because there's a follow-up to it. How many credits is in your IPE module or modules? Prof. Norah, will you be able to respond to the Douglas Maleka's question?
Yes, can you please repeat the first part?
Okay, so a credit-bearing module assists in getting the students engaged and involved. This is something that I'm sure Douglas is suggesting or asking, I don't quite know. And then goes on to ask, how many credits is your IPE modules?
Where for the exact figures of the credits, that one I have to, I don't know it by the head. But anyway, what we normally do, for example, during the examination, which is called IPE, APA, whereby we design a case. And as I've said, in that case, all the disciplines come in. And during our oral exam, because they first do the written one, afterwards they do the oral. So in that oral, that's why we all come in now. The different disciplines will ask this. For example, from maybe from pharmacology, I would ask the use of the drugs. From anatomical pathology, maybe they talk about the anatomical structure of what the case is all about. Maybe it is covering a cardiovascular system. And then we also integrate chemical pathology, whereby they have to do different tests for them to be able to identify the diagnosis of the patient. And of course, if there's any microbiology, which is always there, then they have to look at it like that. So that's how our IP is it's structured. Thanks for the question.
Thank you, Prof. Norah. Can I ask Douglas Maleka, has Prof answered your question?
Good evening, Chairperson. She hasn't, but it's okay. I guess I can engage her out of this because I really wanted to know how much credits is allocated for the IPE-CP module. And actually, the first comment or the first statement I wrote was just a comment to say, you know, what she said, that the IPE-CP is bearing credit is exactly what gets students engaged in IPE CP, because if it is not bearing credit, then students would see it as just an add-on and not necessarily something to take serious. So I am glad she made that point very clear to me. Giving me the number of credits would have actually further illuminated her statement, but it's fine. I can engage her out of this. Thank you.
Thank you very much, Douglas. Appreciate it. And yes, I agree. Putting credits to it will definitely motivate the students, because if there's nothing linked to it, then it's something that is optional to them, kind of thing. Thank you very much. Prof. Norah, do you know by chance maybe what the credits are? If not, I'm sure it's not a big problem, seeing that Douglas has indicated that he'll speak to you outside of the meeting.
Yes, as I said, there are credits allocated to each of those disciplines, but I don't have them by my head, the figures. I don't have them by my head now.
Okay, not a problem. Thank you very much, Prof. Norah. So then you must be on the lookout for Douglas's communication. Thank
No
you.
problem.
Thank you, Prof. Then we also had a question from Tracy, and Tracy was asking about the difference between IPE and the IPE-CP and the place of either in the higher education institutions. And this was a question that she is posing to all of the presenters. I have noted that Dr. Kholvadia has responded to Tracy in the chat as well. So colleagues, you're welcome to go and have a look at the response there. I don't know if the colleagues from the other universities would like to just maybe come in there and add something or give their response to Tracy's question. Prof. Norah, would you like to go? The question Tracy is asking is perspective on the difference between IPE and IPE-CP and the place of either in the higher education institutions. Any one of the other presenters that would like to comment on that or respond? Or are you in agreement with the response that Dr. Kholvadia has given? Yeah, once again, thank you, Dr. Kholvadia, for that response. Nobody else had come forth to add anything there. So thank you, Dr. Kholvadia, for that response. Much appreciated there. And then Luzon, Africa, has also commented on that or replied or responded to Tracy's question. Tracy, I don't know, was that answering you? Are you happy?
Yes, thank you so much.
Oh, you're welcome. I'm so glad. Any other questions, colleagues? I'm trying to just check in the chat as well what we've got there. What I have picked up, colleagues, across the board with these presentations, I think all of you have identified challenges that you are experiencing when it comes to IPE or the IPE-CP. And overcoming this is going to be a problem, especially with the colleagues at Fort Hare mentioning the resistance to interdisciplinary collaboration. Then also, I didn't quite pick up that many from the colleagues at Rhodes University when it comes to that, but I'm sure they also had some. What I would like to ask the colleague at Rhodes University, Mrs. Purcell, your IPE facilitation, you mentioned that it was pharmacists, the MPharm students, nurses, or a medical doctor would go. And I'm assuming these are colleagues outside of the university?
Rosanna, they are actually within the university. So they are employed as staff of the Faculty of Pharmacy to specifically assist with clinical skills training.
Oh, wow, that's awesome. So you have employed colleagues to assist with this, almost like, you know, this program, this engagement that is taking place.
That in addition to assisting occasionally with lectures and practicals, but also for our other work-based learning projects that we have from first year through to fourth year.
Hey, that's lovely. No, you guys are really on track. Your 26 years being involved with this is definitely showing. So, colleagues from Fort Hare, when you indicated that you are new to all of this, I think you need to be knocking on Monique's door there.
Well,
And
I must admit that it's only been, I think, maybe over the past 5 to 10 years that we've had a nurse working with us. It's only very, very recently that we've had a doctor, and also only very recently that we obtained the trailer. But yes, we have been we've been very, very lucky to have Mrs. Lynette van Dijk as part of our team.
no, that's awesome. Awesome news. Thank you very much, Monique, for that. And I'd like to now just thank all of the presenters. I don't know, I don't see any other questions in the chat. I have noted we are now on 19:30. I have asked for 5 minutes extra, so I'm not going to delay any further. But what I can say is that there is definite evidence here that all of the colleagues are open to some form of collaboration and learning from one another. So this webinar was definitely what we needed to just tap into where we are and how we could possibly take this forward as a province when it comes to IPE. Now, there was a bit of a oopsie on my side because the SAAHE Eastern Cape chapter chairperson, Professor Ilse Trutter, was supposed to welcome you guys. But in my excitement to hear all of these stories, I just jumped right in there. So I do apologize to Professor Trutter for overstepping my boundaries. But as we've come to the end of this webinar, I'm going to hand over to Professor Trutter so that she can do the closure and the announcements that goes with it. Thank you very much. Over to you, Professor Trutter.
Thank you, Rosanna. Thank you for giving me the last word, and no problem. Colleagues, I think you were welcomed in any case. I just want to announce at this stage that our next webinar, our last webinar for this year, is planned for Wednesday evening, the 27th of November. And you will see the time slot is from 6 to 8 o'clock. We hope that we will be able to that evening have webinar 4 as well as our AGM, our annual general meeting. But we will communicate this to you closer to the time. And then just the title for the webinar is Ethical Implications of Artificial Intelligence, its use in health professions education, and the perspectives again from our 4 Eastern Cape universities, a panel discussion. It will be led by Dr. Rian van der Venter. So I think a very topical, AI is at the moment in the news and it is developing very fast. So I think it is relevant for us to listen and to be part of that. From my side, I just want to thank each and every one of you for attending this evening, and then our technical team in the background, Philip Hulzer, Matthew Besuidenhout, and then Rosalind Sutton, and then to our presenters, a big thank you for excellent presentations tonight. And you, our audience, we cannot do these webinars without you. My final question or final point that I want to note, we have started to talk to each other now and we've learned a little bit about each other. Will it not be nice if we can start collaborating as 4 institutions in the Eastern Cape now, also with respect to interprofessional education? And Rosanna has already hinted towards knocking on each other's doors. Should we not be doing that more in terms of IPE as well? Just a question that I want to leave you tonight with. Colleagues, thank you very much for this evening. See you all on the 27th of November again. Thank you very much and good night.